Medicare guy. So today I wanted to jump on to talk to you guys about Medicare and just to answer any questions. Several of you all have reached out to me asking questions about Medicare because it is Medicare open enrollment season. So I figured, you know what? I'll just come here and I'll just answer the questions. So if you all have questions about Medicare, you know you can call me. My number 615-509-8105. It's also scrolling below so you can see it there. Of course, you can call me, text, all that stuff, and I can respond. But I've gotten a couple of questions, so I figured I'll go live and answer them. So the first question that we have that is being asked, let's see. All right, Medicare versus Medicaid, and what's the difference? Y'all, that's a good question. So here's the deal. Medicare is a federally funded program managed by the Centers for Medicare and Medicaid Services. Now, Medicare is for people age 65 and up, or those who's been disabled for 24 months. So if you know anyone that's been disabled for a certain amount of time and they pay Medicare taxes, usually at the 25th month, they're automatically issued their Medicare Part A and B, and then they're able to go out and sign up for different Medicare Advantage plans and things like that. Get a prescription drug plan and get the full coverage or holistic health care is what I say. So that's the medical, the hospitalization, the dental, vision, and hearing, prescription drug plans, and all of that stuff. So that's Medicare. Now, Medicaid is completely different. Okay, Medicaid is not based on Medicaid. It's not based on age. Medicaid is strictly based on income. So here in the state of Tennessee, it's also known as TennCare. Some kids that may have Medicaid, I believe the program is called Cover Kids. So that is the assistance program that helps people pay for healthcare coverage. So just to review again, Medicare is a federally funded program for people 65 and older or those that's been disabled for 24 months. The requirement to get Medicare at 65 or at the 25th month of disability is that you have to have worked for a total of at least 40 quarters in your lifetime to qualify for Medicare. Medicaid, remember I told y'all, completely different, okay? Medicaid is for individuals that need financial assistance. They could be kids, adults, it doesn't matter. It's just an assistance program. So, Miss Brenda, that's a good question. Thanks for asking that. So now we know the difference about Medicare and Medicaid. So I'm going to take a couple more questions because we got a little time. Let's see what I got here. How do Medicare Advantages work and are they worth it? Good question. Medicare Advantage plans. Medicare Advantage plans is also known as Medicare Part C. So remember, you have four parts of Medicare. We have Medicare Part A, which covers your hospitalization. Then we have Medicare Part B that covers your medical. I say docs and procs just because it's easy for me to remember, but procedures and doctor's appointments. And then you have Medicare Part D, drugs or prescription drugs. Medicare Part D covers your medication. But then Medicare Part C is known as a Medicare Advantage plan. And Medicare Advantage plans are administered or managed by private health insurance companies. So there's a lot of them, but the ones mainly here in Tennessee, you have United Healthcare, Blue Cross Blue Shield, Cigna, Devoted Health, WellPoint, also known, they were known as Amerigroup. Those are, and it may be some that I'm missing, so don't hold me to just those. But there's a lot of them. So when the question asks Ms. Deborah about a Medicare Advantage plan and if they're worth it, it all depends on you. I'm going to tell you this. A Medicare Advantage plan usually is managed care, right? So the difference between the Medicare Advantage and original Medicare is a Medicare Advantage plan is managed care. So sometimes prior authorizations are required. case managers are assigned, and they want to make sure that you're healthy, that you're going to the doctor, that you're getting your medication, that preventative services are handled, right? So that may be a downfall for some people, because original Medicare is not managed care. So you can go to any doctor you want to go to anytime you want to go. It's just you have to pay the co-insurance. Okay, with the Medicare Advantage plan, you have co-pays and co-insurance too, but it's strict. It's more strict guidelines when it comes to managed care. So to answer your question, Ms. Deborah, is Medicare Advantage worth it? Or how do Medicare Advantage plans work, and are they worth it? The question is, it all depends on your situation. And that's something that I want all of us to understand, that health insurance is an individual type situation. Just because your aunt or your sister has it doesn't mean that you need to get it. Right. So that's why around this time open enrollment is happening. It's important that we research and we find out what plans is best for us, which ones cover our medications, which ones have all our doctors in network, how much dental does every plan offer, and not to get caught up in the healthy grocery card and all that other stuff, because to many people that doesn't matter, but to a lot of people it does. Okay, so if you're needing the healthy grocery card and the utility bill payment, research those plans and find out which ones actually cover that. So that's how Medicare Advantage plans work. And to answer your question, if it's worth, is it worth it, Ms. Deborah? I don't know. You have to weigh your pros and cons and decide whether it's worth it for you. Okay. So while I'm here, I'm gonna take a couple more questions. So I got a little downtime, so I can take some more. So let's see what else we got here. How much does... Sorry, y'all, my camera's right here and it's blocking my view. The question is, how much does Medicare actually cost? You know, Medicare Part A, we pay for it when we pay our taxes. I've been working since I think I was 15. So all these years, if you look on your statement, it's going to show how much you, or it's going to show your Medicare tax. And then at the end of the year, you know, it accumulates and you're able to see how much you paid. But Medicare Part A, we pay for it every time we work. It's just a Medicare tax. That's Medicare Part A. So we don't have to pay any additional. Now, Medicare Part B tends to increase over the years. When I first started in this business, Medicare Part B was, I think, $100, $110. In 2025, they've announced an increase. Now, we know that it's going to increase, but we don't know exactly how much. But we're expecting it to be about $185 for your Medicare Part B premium. So right now it's $174, approximately $174 and some change. Next year it's going to go up to $185 and some change. So if you see your Social Security check decrease a little, Michael, because Michael asked the question, just know that your Medicare Part B premium probably increased, and that's the difference. So get ready for it. It's coming in 2025. All right. And I'm going to take one more question. I said I was going to do this like 2 or 3 days a week. So using the information below, it says direct message or just call me. You can do either one. Y'all know I'm driving a lot or I'm with clients. So if you just text me, I'm able to respond pretty quick. Okay. All right. Let's see what else. I'm going to take one more. What's the deal with Medicare A, B, C, and D? Like, what is the difference between them? Kind of already talked about it. There's 4 parts to Medicare. All of you all who have been in my Medicare school, and I've done multiple Medicare classes over the years, you know the difference. So Medicare Part A is Medicare Part A covers your hospitalization. It's when you go into the hospital. Medicare Part B covers your medical services. So your procedures and your doctor visits is covered under your Medicare Part B, as in boy. Then we have Medicare Part C. which are also known as Medicare Advantage plans, handled by private insurance companies that manage medical benefits for Medicare recipients. And then finally, Medicare Part D. So Medicare Part D, prescription drugs, that's what covers you when you go to the pharmacy and get your medication. So make sure you have all those little pieces put together, tied in, right? So that you have a good medical experience, and make sure you get all your medical care. All right, y'all, I'm gonna take one more, I promise, and then I'm gonna go. Let's see. Once I'm signed up, can I change plans if I need to? Good question, Margaret. So the question, y'all, is it's right there on the screen. Once I'm signed up, can I change plans? So here's the deal. When you say signed up, it kind of leaves a lot out there. But once you enroll into Medicare Part A and B, you have the option to change your plans anytime, well, once a year. All right. So you have a chance to change your plans once a year. So let me repeat that. The question is, once I'm signed up, can I change plans if need to? If I need to. The answer is, once you sign up for Medicare Part A and Medicare Part B, yes, you can change plans. That's why this time of the year is so important, because it's considered Medicare open enrollment season or annual election period. So during this time, you can make your changes. Remember, annual election period. So you make your changes for your benefits for the following year. So Medicare annual election period starts October 15th. It ends December 7th, and the benefits start on January 1st. They take effect. Now, between the months of January, February, and March, it's known as open enrollment period. So for those people that chose to enroll in a Medicare Advantage plan during the months of October 15th through December 7th, you're able to kind of go back. I'm not going to say correct your mistake, but in a way, change your mind and go back to another Medicare situation. So good question. Let's see. I got time for one more, y'all. One more question. If I sign up for Medicare late, am I in trouble? All right. So, if I sign up for Medicare late, am I in trouble? Well, let's define late. Okay. So, many of you have chosen to work past the age of 65. That's great, because most people don't retire at 65. But here's the deal: you're eligible for Medicare at the age of 65. So, what late means to me is that if you're late, if I sign up for Medicare late, okay, you're only late if you go without coverage. So let's say, for instance, you're 65 and you still want to work. You work at Nissan, the benefits are good, everything is you're happy with it. Then when you turn 65, you're going to get a red, white, and blue card. That red, white, and blue card is going to have Medicare Part A on it, because remember what I said earlier, we pay all these years for our Medicare Part A. So we automatically get that at 65. You don't have to sign up. But you do have to sign up for Medicare Part B. But remember, Medicare Part B costs. You pay for it out of your Social Security every month, which going into next year is $185. If you don't have employer coverage or some other form of credible coverage, yes, you are kind of in trouble, because the law, or not law, but the rule is that you can't go without coverage if you have Medicare. And then once you enroll, you're going to be penalized. So to answer your question, if I sign up for Medicare late, am I in trouble? You're not in trouble if you have credible coverage and don't need it. But if you're one of the people probably similar to how I am, it's like, I don't need that, I don't need that, I don't need that. And then all of a sudden you get sick, so you rush to sign up. there's going to be two things that's happening. First, they're going to hold your enrollment application until the cycle continues, until the cycle starts over. So you have to wait. You can't just start Medicare instantly. And then secondly, you're going to be charged what's called a late enrollment penalty. It's also known as LEP. A late enrollment penalty is a lifelong penalty because you never signed up for Medicare Part B until you actually needed it. Okay, so to those of you that's watching, um, whose parents are like my mom, I think it's 65, and then my dad is a little older than her. They both worked past. Well, my dad he worked past 65, right? So they had their benefits from their job, so they didn't really need Medicare Part B or A or B. But once they became eligible, once they lost their employer coverage, like my parents retired, then they went ahead and signed up for Medicare Part A and B. So they're not going to have a late enrollment penalty because they just swapped out. Like they left from their Medicare, they left from their employer coverage, and then they enrolled right into Medicare, and it was never a lapse in coverage. So um, think about that. If you start, when you turn 64, you're going to start getting all this mail. To those of you that's watching whose parents are 63 and 64, help them because it's a lot trying to navigate because you're getting 5 and 6 mailers a day. You're getting 5 calls a day. So who do you trust and what do you read? You can't just trust everybody and you can't just read everything because you'll get confused. So make sure you all are helping your parents with the Medicare situation because it can be a situation. I deal with it every day. So I said I was gonna stop at 1 o'clock. Let me see if I got time for one more. Y'all got any comments, any questions for me while I'm here? I know we're getting some more questions come in. Let's see. Here's another one. Oh, I already answered that one. We talked about that already. It says, are there things that Medicare doesn't cover that might surprise me? Yes. The question is, are there things that Medicare does not cover that may surprise you? And the answer is absolutely yes. And one of the biggest surprises that I see people have is long-term care. Now, I want y'all to listen to this because this is important. Okay. Every one of us have 100 lifetime reserve days for skilled nursing care. Medicare does not cover us for daycare services. It doesn't cover for adult daycare. It doesn't cover respite care, which if someone is taking care of you and they need a break, you want somebody to come in and sit with them. It's not covered under Medicare. And this is a subject that we have to put more and more effort into to those that's listening, because we have to notify people that Medicare doesn't cover you to go to a nursing home. To those of you listening, listen, Medicare will not pay for your parents to go to a nursing home. And I know some of my listeners, because somebody just made a comment, long-term care is not covered under Medicare because health insurance, and this is the way I define it. Health insurance is there to keep you healthy or get you back healthy. Okay? It doesn't cover you just because you want somebody to sit with you at home or you're not getting better. Medicare actually requires that you get better every time. Whenever you go into the hospital, you have to improve. Okay? That's called skilled nursing care. They're helping you. It's skilled care. They're nursing you back to health. If there's ever a possibility or if there's ever an indication that you won't be healthy and you will never recover, then Medicare pulls out and says, okay, we don't cover long-term care. We cover health care. This is health insurance. Okay. So to answer your question, are there things that Medicare does not cover that might surprise you? The answer is yes. And the biggest one that I see is long-term care. And that's how a lot of people they end up going to a nursing home and maybe they lose their homes, they lose their assets to pay for their nursing home stay. So just keep that in mind. And there's other things available. There's other policies like long-term care policies and things like that that you can get. So those of you that are around in your 30s and 40s, I know y'all like this Medicare stuff is years down the line. But long-term care is something that's been around for years. Maybe you don't know about it because it's just never been a priority. But long-term care actually pays for you to stay in a nursing home and get long-term care. Okay, so think about it. Talk to your insurance professionals that you know. Ask them about long-term care. This is if you're in your 30s and 40s. It can be very expensive and it's based on age and health. So it's something the sooner you do it, the better it's going to be. So keep that in mind. But to answer your question, I'll tell you the most surprising um, thing that I hear people say is, I didn't know Medicare don't cover when I go to a nursing home. No, it doesn't. So keep that in mind. You know. Any other questions and comments? I'm gonna be on here another 4 minutes. Y'all know it's Medicare open enrollment season, and we're kind of running around busy. But the Medicare Morning Show is still a thing. We're still around. We're gonna launch our new episodes in January. We got some good information for y'all. Some guests that's gonna come on talking about some things going on in the community, and I have a pharmaceutical company coming on talking about some different meds and how it affects us and all that stuff. So it's gonna be good. So, um, so hey y'all, I am about to get out of here. Um, but it was fun. I'm gonna do this a couple days a week, just answering Medicare questions, especially in January with so many plan changes and stuff. Um, it may be difficult to kind of get in the groove of things starting in January because formularies are different, co-pays are different, provider networks are different. And I'll be right here to answer your questions and kind of help you through those situations. So I'm going to go ahead and jump off here, y'all. But thank you for listening. And y'all have an amazing day and a happy Monday. Also, happy Veterans Day to my veterans. Thank you for your service. So we appreciate you all. So y'all have a good rest of the day. I'm gonna go ahead and jump off of here, and I will see y'all later. Take care.